Advocacy is an integral component of ministerial leadership. With me to share more about what that means for all of us here at Provena Health is LIndsey Artola and Stephanie Faraci. Good morning.
Good morning.
Good morning, Lisa.
How are you today?
Great. How are you?
Good, good. So we talk a lot about advocacy. It's a term that we hear routinely just within our culture. And when we say that, what do we really mean?
Well, I think advocacy, a lot of people equate advocacy with lobbying. And I think that the way we approach advocacy at Provena Health is so much more than lobbying. It's really about providing a voice for the work that we do and for the patients and residents that we serve, both to our representatives in Springfield and in Washington, and helping them to understand the work that we do and how what they're doing in Springfield and Washington really does have a direct impact on our ability to serve our communities. And I think when you think back to our mission statement that says that we build communities of healing and hope by compassionately responding to human need in the spirit of Jesus Christ. Oftentimes we think of that statement as it relates to Jesus' healing touch and being able to heal the sick. But when you really think about Jesus' ministry, a lot of what he did was advocacy. It was really speaking out for the poor, the vulnerable, and the marginalized in the society of his day. And I think what Stephanie and I do and what we take to Springfield and Washington is very similar. It's providing a voice and providing an opportunity for our representatives to hear about the poor, the vulnerable, and the marginalized, and how they can help.
So is it really, a matter of you just kind of telling our story, or is it what is the real benefit in terms of really being that kind of an advocate for our mission, Provena Health, the impact that we're having? How do our elected officials really respond? What do we want them to kind of get from that story?
Well, I think one of the things that I tell people is healthcare is a very highly regulated industry. I know Connie is very fond of saying that the nursing home industry is second only to nuclear power in terms of the level of regulation that they're subject to. And certainly when you think about the Medicare and the Medicaid program and how incredibly important those are as revenue sources for the ministry, it's really important for our legislators to understand how what they do impacts us. And when you think about legislators in Springfield and Washington, in a typical day, they can be dealing with education issues, transportation issues, healthcare issues, natural resource issues, finance issues. They can't possibly be experts in all those areas. So we see our role as one of educating them, and they really seek out the education on how is this bill or how is this regulation going to impact the hospital or the nursing home or the home care agency in my community. How is it going to impact our constituents? And they really look to us and they want to hear from us. Yeah. They want to understand how it's doing.
And it's overwhelming, as you say, for an elected official to kind of get their head around all that's going on, and certainly healthcare and the regulations, the various ways that bills and things can be affecting us. It's equally as daunting, I think, sometimes for the average Provena Health leader, to possibly understand the impact of some of the proposed legislation that might be out there. And so what can we do to help be informed, to be prepared to really help support our advocacy efforts?
We have quite a few tools that we've put together over the last several years to help our employees navigate the legislative process. Like you mentioned, it is incredibly complex and daunting for the average person who might not be very familiar. So we have a handful of tools that our employees can use in order to engage with their legislators and help convey that message. One in particular is a legislative resource guide where it outlines how a bill becomes a law. Who are your legislators? How do I write a letter to my legislators? That's something that is available on our advocacy website. It's provena.org/advocacy. And that's something that has all types of information, whether it's healthcare reform information, how to link up on specific issues, how to register to vote. All of that information is put on our website. And then we also have an advocacy subscription list. Again, it's something that you can subscribe to on our website, where each week I send out an email that has the basics on exactly what legislation has been proposed in Springfield and DC and how those things impact Provena specifically.
It's interesting that you talk about subscribing to the advocacy alerts, because as we talk about it in terms of ministerial leadership, I know, for example, that's an opportunity for leaders to really become more informed about what issues are important to us, and in terms of really demonstrating our role as ministerial leaders. You know, isn't that something that we all could really do to start to become informed and become more educated on the process?
Yeah, it's a very simple way to stay informed. Stephanie will put links in there that you just click the link and you can send an email. It's already written. You just have to put your address in. It'll send it directly to your legislator. And I think legislators want to hear not just from the Stephanies and the Lindseys of Provena. It's very important for them to hear from the direct caregivers and those folks that are touching the patients and the residents directly, and really are going to be impacted most directly by the legislation. And Stephanie can give a great example, I think, of recently a bill that's been in Springfield and how hearing from the folks in her community made a big difference for one particular legislator.
I'd like to hear a little bit about that, because you think, I know that the times that I send the emails through the advocacy alerts, you're like, okay, it's out there, you know, whatever happened with it, did it really make a difference? Can it really make a difference? And so I'm eager to hear your example.
Yeah, absolutely, it makes a difference. We had a situation just in the last couple of weeks where House Bill 5033, it's the mandatory nurse staffing ratios legislation that has been proposed every year for the last 9 years. The actual chairman of the committee where the bill was going to be heard is the representative that represents Champaign. So we had an opportunity, we called the morning of and had David Bertowski, our CEO, he was able to come in, meet with her that afternoon. It was a terrific meeting, and the representative, who had originally said she was going to vote for the legislation, had a meeting with Mr. Bertowski and myself where she had changed her vote to yes, but still wanted to hear from constituents. And so over the next couple days, we were able to make sure our staff nurses who are interacting with the patients were communicating with her. These are people who live in the district, who utilize her services. She represents them. And when I saw her in Springfield a couple days later, she said, really what helped me decide my vote was hearing from those staff nurses. And it was so empowering for me, because I see her all the time. But when she hears that voice from those people, it just makes that much more of a difference.
That's great. So provena.org/advocacy. Sign up, check it out. Lindsey and Stephanie, thanks for your time today.
Thanks for having us.